Hi, I'm Michelle Welch, registered dietitian in charge of wellness for Lincoln Public Schools. Today on Simple Choices, we'll bring you access to health experts from across the Lincoln community, some stories of inspiration, and ideas that may ultimately lead your family to make simple choices for better health. Watch closely, as you're likely to see some familiar faces from your own backyard. For each of us, having better health is often about improving our choices in small, simple ways. Come along with us and find those little steps to make your life, for you and your family, just that much better. Our first guest on Simple Choices is Dr. Bob Rauner, a physician with the passion to help the health of our community. Bob Rauner is the leader of Partnership for Healthy Lincoln. Bob, welcome to our show.
Thanks.
Tell us a little bit about what Partnership for a Healthy Lincoln does.
Well, we're a community nonprofit formed about a year and a half ago with funding from the Community Health Endowment and Catholic Health Initiatives and the County Medical Society. Basically to try and find ways to make the city healthier, less obese, trying best ways to find how to improve that as a community.
In your practice as a physician, what are some examples of health issues you've seen regularly related to weight?
Well, it's kind of what got me started onto this project. I was a family physician for about 15 years and regularly saw problems in the clinic. And more so, they were due to people being obese and not fit. The number of diabetics that we kept seeing kept increasing every year. And of course we saw the complications to that. We got to the point where we were seeing diabetes younger and younger. Adult onset diabetes used to be called adult onset. It's no longer called that because now people get it as children now. And
right.
So just seeing that over the course of years and realizing that this isn't something we can fix in the doctor's office, it has to be fixed in the community.
Okay. Very good. Well, we appreciate having you working for our community. Tell us a little bit about the data that you've been able to collect from the Lincoln Public Schools and what that means for our community.
Okay. Well, one of the things, if you look into public health issues, how to solve them, if you look at the people who, for example, solve smallpox, they have a model that they use, and step number one is finding out how big your problem is.
Right.
You got to measure the problem.
Absolutely.
And so we started in the schools because that's where most of the kids are.
Right.
A lot of physicians tried to start in the doctor's office, but honestly, most kids don't come to the doctor's office unless they're sick. So if you're going to screen the average kid, the schools is the place to start. That's also where they are. You have access to a large percentage of the population of Lincoln just in one organization, and then just the opportunities were there. I started meeting with Dr. Maribel Avery, who's the head of physical education and the health curriculum there, and came to find out that a lot of the screening was done, but we just didn't have a centralized access to it and a way to put it all together and really get rates for the whole community. And so that's one of the things we've done.
So you worked with Lincoln Public Schools to be able to tie that back together, and what information did you gather from that?
Okay. Well, some surprising things. So one is that our obesity epidemic is just as bad in Lincoln as it is every place else. If you look at the average for the country, it's around 17, 18, 19%. And that's where we found out where we're in Lincoln. Until we went and looked, we really don't know. The state still doesn't know where it really is. But in Lincoln, we know. And then we have more detail on it. We know that it actually starts very low. Only about 11 to 12% of our kindergartners are obese. Okay. Huge increase between first and third grade. And then by the time they get to sixth grade, you're at 20% plus obese, which is big.
Right.
Other things we find out is that there's very big socioeconomic disparities. So the poorer schools have much higher obesity rates than the wealthier schools. So that gave us some idea of where do we go. Right. If we're going to fix this, you go to where the need is greatest. And so it helped us prioritize where we went with our efforts.
Okay. So what are your overall goals right now that you're establishing for the community to know more about? Okay.
Well, our biggest thing is honestly establishing a long-term target. Where do we want to be 3, 4, 5 years from now? Basically, we picked right now our obesity rate for K through 8 put together is 17.2%.
Okay.
We have another
That's
community.
obesity rate?
Obesity.
Wow.
If we add obese and overweight.
17.2%.
Yeah, 17.2.
Okay.
So.
All right.
There's another community in Nebraska, Kearney actually has already reduced its obesity rate by doing some of the same things we're trying to do. They decreased that by about 13%, so we figured if they can do it, we can do it.
Right.
And so we set our target in 2015 to be less than 15%. So we want our less than 15% of our K through 8 kids to be obese by then. We think we can do it because it's already been done in other places.
Okay. And what we really know from national data, with us both being health professionals, is every year it just kind of keeps creeping up. So to be able to stem the flow of that and head it back in the right direction, what are some steps that you think are really a big part of our finding that formula for better success?
Okay. The first thing is understanding that it's not just one thing. We always are prone to say, well, what's the one thing causing this? And there is no one thing. That's probably our biggest challenge with obesity. The biggest, if you say what's the biggest single cause, well, that's beverages. We drink too much sugar compared to 10, 15, 20 years ago.
Okay.
But doing that, just that isn't going to fix it because we're not as active as we used to be.
Right.
We know, for example, that children should get about 12,000 steps a day. Well, when we actually did a study to look in Lincoln Public Schools and a bunch of fourth graders, we found out it's about 7,000 steps a day, which is far less than that should be.
Right. Even though we feel like our kids are running around way more than we are,
Yep.
they just aren't running around like they used to, are they?
Yeah, and what they find is that it's where the school can be involved, because when kids go to school, you can't stop them from running around. So kindergartners are very active kids, but as they get into the school mindset where we sit and we listen, and if there's no PE classes, not enough recess, not enough activity, they just are trained to sit. And so when they show up at school, they're probably in the 12,000, but within a couple of years, they're trained to sit more. And we need to change how we do our instruction. And so one of the things we've actually added that I think is going to help us a lot is we actually started correlating the instruction and academics with our fitness and our obesity data.
Okay, so let's talk a little bit about, I know that that's been something that we've been working on together, but that I'd really like to make sure our community knows more about, is looking at what data is showing within Lincoln Public Schools related to math and reading scores and physical fitness status of our students.
Yeah. Well, basically what we did is, since we had fitness and obesity all in the same data set, we were able to add the state math and reading scores to find out, well, is there any relationship? Because the schools are always challenged with, your main job is math and reading. Well, are they correlated? Well, it turns out they're actually pretty strong. There are some differences on weight, meaning obese kids fail the math and reading tests more than the normal weight kids.
Okay.
Now, most of that effect goes away when you control for fitness. Fitness is actually the biggest difference, and it's actually much bigger than I expected.
Okay.
I thought there would be some stuff, because there's a lot of good studies out there showing that when you exercise, you do learn faster, you do remember more, you retain more information at all ages. But actually our fitness, it's almost a twofold fail rate, meaning the kids who are fit, around 15% fail the math test. If you take the unfit kids, it's around 29%, so it's a huge jump.
Wow.
And so that's, I think, really added a lot of ammunition to the fact that you can't just make them sit still in a math class and expect math to get better if that's your only focus. You actually have to keep kids more active. And of the two, actually, interesting, math seems to have a stronger correlation than reading does, for whatever reason.
And so probably one of the biggest things that we're working on together as a partnership with all of our community partners is really figuring out different ways to A, get families to move more, and B, to help kids move throughout the day so that then they really become more fit, and that also that it could potentially impact reading and math scores, right?
Yeah. And then to do that within a tight budget. That's, you know, the elephant in the room that nobody wants to talk about is how much it's going to cost.
Right.
The good news is some things don't cost any money, meaning drinking less pop doesn't cost any money. Actually, it saves you money.
Right.
And then there are ways to both learn and move at the same time. We actually have a number of programs where the kids in math class have a mat with numbers on it and they jump to the correct answer. And not only does that get them active, it's actually a more effective way to learn. A lot of, even medical education, they're finding that going to a conference and sitting in your bottom all day is actually not a very good way to learn things. And then even in the schools, sitting down is not, as your only way of learning, is a bad idea too. You need to get people up and moving, get hands-on, sing about it. I mean, there's lots of different ways. There's a Velcro theory of memory. The more hooks you can get to help people remember things, that's why mnemonics help, you know, when people have the word that helps them remember something else.
Absolutely.
And because, so the more you can do, and so I think moving kids will actually not only make them more fit, it'll actually make them smarter, which is part of the things we're trying to explain.
Well, one thing I think is kind of an interesting point for us to discuss is, you know, getting kids to move in elementary school, there's a lot kind of more natural things that happen because those kids are still wiggling. But when we get to the kids when they're in middle school and high school, how important is activity and how we incorporate that into their lives as well?
Well, that's something that shows. Not only does the obesity rate get worse, kids become less active, which is, of course, part of the RIT problem. We have some things that counteract that in a little bit in Lincoln, in that we actually have more PE as kids get into middle school. And that probably flattens our loss of fitness. And if you look at our data, it's pretty flat from 4th to 8th grade, whereas other states, it tends to keep getting worse, because that's maybe partially just because elementary has so little physical activity. We don't have any, we only have 1 day of PE on average in our elementary schools. Some things actually benefit things. As kids get to middle school, parents are more comfortable with letting their children walk to school. So they're getting a little more activity because they're walking to school. There's more access to sports because the middle schools actually have some sports that's right after school, whereas most of our elementaries don't have a soccer team, they don't have a basketball team. But our middle schools do have some teams, so there is a little bit more access to that.
Okay. Talk to me about the student that reaches that 10, 11, 12, and you know, sports just aren't for them. And so, what, you know, from your opinion, what are some things that we can do to help get those kids moving a little bit more?
I think changing some of the emphasis from competitive sports where people get cut from the team, that's important if you want to have the state championship basketball team or football team, but the problem is you have to do something that works for all kids.
Right.
That means having some different things. Some kids just aren't football and basketball. Some kids want to do dance. Some kids want to do yoga.
Right.
Some kids want to do other things. And so I think you need a variety. I would really hope that we would do more intramural type things. You know, college, you know, hardly anybody makes the college team, but most colleges do have a good intramural program running,
right,
where the kids who just want to play for fun can go play.
Right. I think that's one thing that we can encourage families to really tie into is figuring out if their child just isn't that child that's looking to become a pro athlete, although I'm sure they all dream of it. You know, if their kid just isn't cut out for that, and they're kind of starting to steer away from those organized sports, families really want to engage into a plan B that will really help them to keep active for a lifetime. And I think, you know, we are so fortunate in Lincoln because we have the trail system and so many resources. So how do we help direct families to those resources?
Okay. Well, some of it is finding stuff that doesn't cost money or involve transportation. One of the reasons why in the poorer areas of the town the obesity and fitness is much lower is simply lack of access. If you have a single parent family or both parents are working, driving the kid to the Y soccer at 4 p.m. just isn't an option for them. What can you do that's in the community that the kid can do? We have some communities that have really good rec centers nearby where kids can just drop in and play pickup games of whatever. I think the bike paths are great for the places where you have that. We probably need to encourage more of that pickup playing games stuff that we used to do when I was a kid. I grew up in Omaha in grade school, and everybody played soccer, and that's what we did after school. We just went to somebody's backyard and played soccer all afternoon. And that doesn't seem to happen as much, partially because of the stuff inside, which is screen time. And so screen time's a thing we have to kind of
They may be playing basketball, but with their thumbs.
Yes. Now, the interesting thing is that they're coming out with newer innovative things, like the dance things that you can do with the Wii. My kids do quite a bit of that, and they love that. And so that actually so there are ways to use technology for the good. It's not just it's not all evil. There's good and evil to it.
Well, and during cold Nebraska winters, being outside to play sometimes isn't a reality for people. And you know, one thing I think for families that they can do that can be really powerful is if they have kids that are playing video games, a rule in our family is you have to be standing up if you're playing. You can't be sitting down and laying on the couch playing. If you're going to play, even if it's not an active game, you have to be standing or you don't get to play. So, and also setting limits on those can make a huge difference. So, well, we thank you for all the work that you're doing to help us learn more about really where we're at and where we're going. And thank you so much for your commitment to make our community healthier.
You're welcome. It's good to be on.
We'll be right back. Thank you.
Hi, I'm Sharon, and I'm a school nurse. And today we want to talk just a little bit about fitness and wellness. It's important that your child and your student remain active even here at school. So we want to assure you in the health office that we're able to treat any of their bumps, scrapes, or bruises. We're prepared to provide Band-Aids and whatever they need here at school, but we also do treat them if they would have head injuries and have a very strict protocol that we would put into place if they had a head injury, where we would contact you and let you know that they'd had a head injury. We also have a checklist that we go through, a symptoms checklist, to let us know how serious of a condition it is. And then we follow up with you based on that checklist, but we would always let you know if they had that here at school. So if you're getting a lot of phone calls home talking about head injuries, just know that it is part of our protocol. We also have a letter that we would send home that would let you know what symptoms to look for that night in the event that it could be a concussion. Of course, if we thought your student had a concussion, we would have you come and pick them up then. So not only is it important for your student to stay active here at school, we really want them to be active after school. So being involved in after-school activities, in sports, and then also at home and involving your family in daily exercise, at least 30 minutes a day, most days of the week, is very important. Remember, the door is always open here in the health office. If you have any questions, you can always refer to your school nurse.
Hi, this is Michelle Welch, registered dietitian with Channel 10 Health, wanting to bring in for you a little bit of examples of what I find is probably one of the most asked questions from families each and every day in my work with Lincoln Public Schools, and that is, if they have kids that are picky eaters that want to pack a lunch, what can they pack that's healthy? We have lots of things available to us off the store shelves that are processed, but what are some better choices that are available? Today I'm going to show you. Let's start in the fruit and vegetables department. My biggest trick is really making sure, let's choose items that are pre-sliced, ready to go, and make it easier for your kids to have them go in their mouth instead of in the trash. The chance of your child eating an apple is a lot stronger if it's rather cut into slices and ready to go, or if it's in an applesauce form. Other things that work great are items like celery, pre-wedged oranges, berries, grape tomatoes, and even if you can use applesauce, like a natural applesauce, that can work well for you too. If you do choose to pack a juice, if your child doesn't drink milk, make sure and pack just a small juice and then back that up with a bottled water in your bag. As we move our way over into the grain section, one thing that I really find for a lot of people is they get real stumped when they're trying to think of what can I use for whole grains for my kids. This is something where you can save yourself a lot of dollars by packing lunch from the standpoint of, instead of buying the pre-processed packages that don't have as much whole grain, you can make your own packs and really save yourself dollars and cents. Some examples I can show you right here are cereal mixes that I made out of just some oat cereal from my house, along with a little bit of nuts and trail mix. It helps to stretch the trail mix, which is more expensive, but it also helps to give the kids more fiber and whole grains. Another example that you can use is a whole grain bun. A lot of these have around 5 grams of fiber, which make it a great choice for the kids. Items such as pita chips can work in, corn nuts, but probably one of my very favorites, because we all like that little bit of salt and crunch, is the popcorn. If you cook this the night before and put it in a sack, you're ready to go in the morning. Don't have to worry about cooking that popcorn off, and it really can work great as the nice crunch of munch for any time in the day for you as an adult, but for the kids at lunch in place of something along the lines of chips. So that can really help. Also, don't forget about the type of tortilla you use. If you like tortillas, can really make a difference. Look for the ones that are higher in fiber, and also the same thing can be said for your breakfast bars or granola bars if you're using those. Try to find ones that have about 5 grams of fiber. Typically the kids like those, and they typically will go in their mouth instead of in the trash. Last but not least, let's come over to the protein and milk section. And as you look at protein, a lot of things that families are dealing with is schools can't always let you pack a peanut butter sandwich these days because of the kids with nut allergies. And so really be careful to find out from your school what kind of limitations they have, because there are some kids with some very serious, severe nut allergies. So it's very important to pay attention to that. If you do have a situation where you can pack some items, and a good example is these pre-shelled sunflower seeds. A 1/4 cup is about right for both us as adults and for the kids to be able to have a nice serving, both for any type of sunflower seeds, nuts, almonds, or items such as soy nuts. You can also choose some of the nice lean deli meats that are available, but the biggest trick is, let's keep our food safe for the kids. One trick to be able to do that is packing an old bottle of water that you can use that way. I'll take a bottle of water, refill it with water, and freeze it in the freezer. That way you've got yourself a free, instead of expensive, ice pack that if the kids happen to misplace it, you aren't out of your ice pack. It also gives the kids a little bit more water to have with their lunch, which is always a good thing. Finally, let's get to the dairy section, which is one of our biggest pieces of the kids' nutrition puzzle. The best thing that we have available to us is most schools provide milk available for the kids, even if they pack their lunch. And so make sure and take advantage of that. Other great opportunities to get dairy, calcium, protein include utilizing items such as yogurt or cheese sticks can work very well. This is just a small sampling of great opportunities that you have to have a healthier lunch pack for your kids that they're actually going to choose, enjoy, and like. If you'd like more ideas on healthy lunch packing, go to the LPS website, lps.org/wellness, and click on the link to Healthy Lunch Ideas. Here is a quick tip to be able to trick your family into choosing more fruits and vegetables as they head out the door or are passing by in the kitchen, instead of choosing those other things you'd like them to choose less. Just set out a really nice bowl, plate, cake platter, whatever you have, with some fruits on them, and watch them disappear. For Channel 10, this has been Michelle Welch, Registered Dietitian of Lincoln Public Schools. Thank you.
Our organization is Leadership Lincoln, and my primary role there is to coordinate the Youth Leadership Lincoln program. This program serves students who are sophomores in high school, and it is a leadership development organization.
We've had a lot of program days. A lot was dedicated to just learning about the city.
Each different month we focus on something new, like We've done healthcare today. Our very first meeting, we went all around Lincoln and learned about the different parts, like the history of the town. We've learned about like the law and legislature.
So today we're here, we're hosted by St. Elizabeth Regional Medical Center, and we are focusing on healthcare issues in our community today.
We are learning about the healthcare in Nebraska and all the different areas of healthcare. So we are being exposed to all these lots of different careers in healthcare, and we're just learning about what they do and their options and the importance of just having good coverage in our lives and how it can really benefit us.
So we're learning about the difference between primary care and acute care. We're learning about the Partnership for Healthy Lincoln, which is an organization focused on obesity and youth in our community.
I didn't realize how great LPS is in need of kind of some changes in their system to provide better nutrition options for the children. I also have learned more about the ethics of healthcare through some games we've played and just through some situations that they've kind of put us in.
And a lot about the brain injuries and how they can live on after they've had like concussions or brain injuries and stuff.
We had a lot of engagement with the medical ethics scenarios, had some kids who were very unaware of some of the situations that doctors and nurses face and were very challenged by those situations and by the prospect of having to face those choices themselves.
I've learned just a lot of like staggering facts from the PowerPoints, and it kind of really opened up my eyes.
Well, I'd really love to go into medicine someday. I have two parents who are in healthcare, and today we just saw how wide of a variety of medical care options there were and all the different fields that we can go into.
How do you navigate it to be careful to not puncture arteries?
Most of them are designed to be kind of flexible, but that's what we see. That's all we see. So most of it's done by feel as you navigate through the body.
So just knowing really what's out there for us, and it really just helps to help us set a goal to where we want to be in the future.
And I think also, if you're not living healthy, a lot of students don't know how much that actually affects their grades and stuff. Like today we learned about how if you're having a lot of stress because of your weight, it doesn't only affect your fitness, it affects your grades, and students don't realize that all the junk they're eating, how much that's affecting other things in your life besides how big you are and what your weight is.
Healthcare and government go hand in hand, and it's a growing crisis in the community.
And it affects everybody no matter if they realize it or not.
It definitely plays a role in our community and in our city.
We're very much focused on helping kids get to know their community better, to build their skills, and then we want to connect the two, have them use their skills to improve their community and be contributing back.
I was a part of this project from the Brain Injury Association of Nebraska. It was this project called Cranestorm, where they were asking for donations of origami cranes to help promote brain injury awareness. And I put together a club at school, and together we made, over the course of 5 months, exactly 7,000 origami cranes. And we were one of their largest contributors in Nebraska.
For students who are in their sophomore year of high school, it is very significant for them to understand the healthcare environment in which they live and also to be a part of that, to give back to it. It's important for them to understand who it is that provides their healthcare and who contributes to providing a healthy environment in their community, and allow them an opportunity to contribute back to that system in a positive and meaningful way.
If you don't care now and if you're not aware now, it'll come back to bite you later. And I think it's better to be aware now, and especially when it comes voting time, you're going to want to know who you're voting for and if that'll affect our country.
If I were to tell other youth in our community about healthcare and stuff, I would just say really get involved with your community and get involved with the hospitals and the brain trauma treatment care places and just all these different opportunities that we have in Lincoln to get involved.
Well, I would say to be aware of all the stuff that's in healthcare and just know what would fit your standards of how healthcare works.
It's important for us to be healthy. Otherwise, what's going to happen to our kids? Because everyone knows that it passes from parents to children.
We're taking away just knowing that how important that it is for us to stay healthy, keep up with knowing about healthcare, and just being all around informed.
Don't eat bad food, because later on down the line it might taste good right now. It might taste good right now, but later on down the line it's going to come back on you.
Just be very aware and try to make Lincoln a more fit city.
Thanks for joining us today here on Simple Choices. We're glad to have you along with us. Please join us next time and think about the simple choices you can make each day to make your family just that little bit healthier. Thank you.